Hello everybody, I am Dr. Aparna, Senior Consultant Obstetrician and Gynecologist from Rainbow Hospital, Secunderabad. So whenever a mother is confronted with any medical disorder, which may be a pre-existing one or something that has come as a new onset during this pregnancy journey, the family has the biggest question. Everyone is anxious. How is the baby? Is the baby being affected by this medical disorder? And with the advances of fetal medicine and the ability to monitor the fetus has improved a lot, and we will be able to ensure the mother and the family that the baby growth is fine by doing various scans and testing by the fetal medicine specialist, and also intervene if required when there are certain concerns highlighted to ensure the well-being of the baby and the mother. So today we have our fetal medicine specialist Dr. Gauri from Rainbow Hospital, who would throw light on the various aspects of fetal monitoring during medical disorder of pregnancy. Welcome Dr. Gauri. So Madam, please tell us as to why close fetal monitoring is really required when the mother is having any other medical disorder.
Very good question. See, mother and child is one unit. In the pregnancy, mother and fetus is a single unit, and that is connected by placenta. Any medical condition which is affecting the mother's health, it can be a BP, it can be a sugar, it can be a thyroid, it can be any autoimmune disorder.
Yes.
That there is certainly chance that can affect adversely to the fetus. So in these conditions where the mother is having certain medical disorders, it is not only obstetrician's role is very important. It requires multidisciplinary team which consists of the obstetrician, fetal medicine who will monitor the fetus, then neonatologist who will look after the baby after birth, or cardiologist, and any the number of more complicated case, more number of the people will be involved in the team.
So madam, in which medical disorders do you think that close fetal monitoring is required?
Most common in my day-to-day practice is hypertension, followed by diabetes, followed by autoimmune disorders like SLE, rheumatoid arthritis, Sjogren and all.
Yes.
And some new diseases came up, like late fertility because of sedentary lifestyle and education, working women. That makes them again the precious pregnancy. And obesity is so common nowadays. The day by day it is increasing. So more and more women become conscious about their weights and all, and they are going for the weight reduction surgeries. That adversely affect the
So either extreme, obesity and people who are undergoing weight reduction.
Weight reductions.
So all these women require close fetal monitoring for the various reasons. Yeah. So Dr. Gauri, during monitoring for a fetus, when the mother is having a medical disorder, what specific tests or scans would you recommend?
See, scans, there are general scans and there are very specific scans.
Yes.
General scans which every woman should undergo. Viability scan is very important because that forms a base of all monitoring. Like 15% of the women will have the wrong dates or conception, and their last period date is not tallying. So early scan gives the clue whether baby is going far ahead or baby is less for the week of gestation and all. So that rectification is very, very important. Second scan I will recommend is NT scan. NT scan is for Down syndrome and early abnormalities. 60% of the abnormalities you can detect on the NT scans. And one important Doppler in NT scan, which is very, very crucial for the monitoring of the baby's growth and all, is a uterine Doppler. Uterine Doppler is, in simple, but if I tell you, uterine artery Doppler is how much flow, how much nutrition, how much blood supply mother is giving to the fetus. So if uterine artery Doppler is sufficient, it is good, and mother is giving adequate blood supply to the baby, then that woman having baby with less weight or that mother having future hypertension is less. If she is not giving good blood supply, then we can give a simple remedy like low dose of aspirin and all, which will be the very game changing. So that low dose aspirin can prevent her hypertension. That can help baby to grow well. And again that will helpful for even autoimmune disorders. So NT scan is very important. Again 21 week scans, 21 week scan is called as anomaly scan, which is for everyone. And again I'll add one extra scan to this lady is 24 weeks echo scan, echocardiography, detailed examination of the heart of the fetus. Those who are having diabetes, those who are having autoimmune disorders, those who are having obesity, those people, the echo is very important, because these candidates are likely to have abnormal heart conditions like structural problem or conduction problems. And these medical disorder women, I will space them for future scans little early. Like normal women, I might do the scan at 30 weeks and 36 weeks, that's it. But for these people, I might call 2-3 weeks early, like 28 week, 32 weeks and 36 weeks.
Yes. Madam, what is this Doppler assessment and how does it help us to ensure the well-being of the fetus?
Doppler, in a simple word, I'll suggest is, Doppler is a blood supply to the particular vessel. Now, it's a pulse of the baby. There are the two units. One is from mother to the baby, mother to the placenta, which is called as a maternal placental unit. Second unit is a placenta to the baby, which is through umbilical cord. Third vessel I'll suggest is a MCA. MCA is nothing but a blood supply in the brain of the baby. Because why we chosen the blood supply in the brain? Because always blood supply in the brain will be positive. So monitoring MCA is very important. Fourth vessel I'll suggest is a venous blood supply of the baby through umbilical vein or ductus venosus. It is like a jugular vein of the adult.
So basically we monitor the Doppler velocities in 4 vessels.
All 4 vessels.
The umbilical arteries, the uterine arteries, the middle cerebral artery and the ductus venosus. So madam, how frequently would you advise fetal monitoring for patients, for mothers who are having some medical disorders?
See, normally we do the scan like early pregnancy scan, followed by NT scan, followed by anomaly scan. For these people, one additional echo might required, and not like normal pregnancy. In normal pregnancy, we'll only call for the 30 week scan and 36 weeks. 2 growth scans are sufficient. These people, because they are prone for the more complications, we might call them early. If everything goes well, 28 week scan, then 32 week scan, and 36 week scan. In general, 1 month, 4 weekly, 1 scan. If everything goes well, if something is not going well, like baby is not growing properly or baby is showing the complications, then as and when required, depending upon the situation, we will modify the frequency of the scanning.
So if required, we may have to call them weekly or sometimes bi-weekly or sometimes once in 2 weeks, depending upon the growth.
Definitely.
Madam, what is the role of biophysical profile in this?
Biophysical profile is an ancient test where the baby's behavior is monitored in the scan. Like biophysical profile is having 10 score. Each parameter carries 2 score. Baby's breathing, baby's movement, Leica amount, Dopplers and NST. The most important is the fetal Doppler and NST.
So madam, what abnormalities in the Doppler would you see?
Unless 60% of the placenta is stops functioning, Doppler changes will not obvious on the screen. So initially it try to maintain the growth. Earliest sign of this baby required more frequent monitoring is the growth lag. Suppose suddenly the baby was growing till 50 percentile and suddenly it is stopping to the 10 percentile, then next week again it is going to the 5 percentile and the 2 percentile. So that is worrisome. So growth chart monitoring is very important. When the growth is not growing, then comes role of Doppler. Certain point of the time, the growth is not growing and Doppler changes starts occurring. First stage of the Doppler changes is a high resistance flow. Suppose the given baby need to get the certain amount of blood supply and it is not getting and it is getting less, like 20% less, 30% less, or 50% less, that will be shown as increased PI, increased resistance in the umbilical artery. Second stage, umbilical artery also gives up, and the blood vessel in the brain, like MCA, middle cerebral artery, which was maintaining well blood supply, it starts showing the reduced resistance paradoxically. That means
Sparing
brain
effect.
sparing effect. Correct. So, and the third is a venous Doppler changes. Ductus venous also given away and gave up, and the baby started compromising, and the fourth stage is a rhythm abnormality or movement abnormality. So, monitoring we are doing through the scan is not only important, the most crucial step I will suggest for the mother is a monitoring of the fetal kick counts. Because we can't keep monitoring the baby daily scans and all in early stages. So, mother can be the primary person who can monitoring for the well-being of the baby.
Yes. So, madam, what are the various changes in the umbilical artery Doppler itself? Is it just an increased resistance or some further changes will be seen?
When 60% of the placenta goes, umbilical artery shows increased resistance.
Yes, ma'am.
That keep on increasing. When 80% of the placenta goes, it shows absent, generally absent blood flow in the umbilical artery. Still further stage, worst stage is a reversal. Depending upon how, what is the stage of, what is the week of gestation, whether it is 28 weeks or 32 weeks or 36 weeks, we can plan delivery. Like 28 week, we can still, we don't need to act at increased resistance itself. We can wait till absent or reversal. 32 weeks, because baby is matured enough. When the increased resistance or absent, we can deliver. 36 week,
definitely.
Already baby is nicely growing.
The
increased resistance is enough for the delivery.
Yes, ma'am. So basically the obstetrician will be taking the call as to the gestational age, the maturity, the medical condition of the mother, and then take a call for delivery.
Exactly.
Yes, ma'am. So is it possible to anticipate fetal problems before the complications actually start?
Good question again. See, here the importance of fetal medicine I'll suggest here is a growth chart monitoring. Suppose I get often this scenario where multiple scans, multiple doctor has been done, and there is no growth chart monitored. How I know? What was the growth before? Now what is now? So here growth chart plotting is very important. Baby at 20 weeks, how much was the weight? How much was the percentage? 28 week, how much it is percentile. 32 weeks, how it is falling. So now the 50 percentile baby, now it is dropping to the 5 percentile or 10 percentile. It is falling, it is not growing. You understand? So the growth chart monitoring is very important here. One more important scenario I will suggest you here is a MCA, monitoring in the RS isoimmunization. Lady's negative blood group, she had one pregnancy, which is, first baby is RH positive. She developed the antibody. You monitor her with ICT, and you refer to me with ICT positive. She's already sensitized. Now the fetal anemia signs like polyhydramnios, Lycurmore, or hepatomegaly, splenomegaly, placentomegaly, those are remote. Before that, simple monitoring of the baby with MCA Doppler forms very crucial role. We can give the blood transfusion for this baby, and 100% we can save this pregnancy
transfusion.
By transfusion, exactly. Way before it takes further complicates and further damages the fetus.
So Dr. Gauri, how do you think the multidisciplinary approach of BirthRight help in managing and monitoring these women who are having a medical disorder, so that we give them the best outcome and the right time decisions and the best outcome to the fetus?
See, it's always teamwork, because I alone can't help her, you alone can't help her. She has a medical disorder, like a simple, we'll take example of the hypertension. She has a hypertension, you gave her, I have done the scan for her, we started her on ecosprin, which is preventive measures. Despite of all means, she ended up in GR. growth of the baby is not growing well. So for the suppose 34 weeks, baby is 1.5 kg only. Here, and there are certain points, Dopplers are showing abnormality. Keeping her inside is dangerous. So getting baby out and giving whatever the best can be done for the baby after birth, it is the only option you have in hand. Here, neonatologist comes very crucial.
Yes.
Second scenario, I will tell you, mother is SLE.
And so is the maternal monitoring.
Maternal
like the mother
monitoring.
is having very high blood
risk.
pressure.
Exactly.
Then a physician, a cardiologist, everybody will come into play.
Because she is hypertensive,
Yeah.
she has her own complications. She need to have the
and
hospital.
the right anesthesia.
Anesthesia.
And MICU.
MICU.
Yeah.
So there has to be parallel mother's ICU.
Yes.
And there has to be parallel baby's ICU for her.
Yes.
Now second scenario I'll tell you is SLE.
Yeah.
She is a SLE case, she is prone for hypertension again, baby is not growing.
Yeah.
Add on to this, if baby develops rhythm abnormality.
Yeah.
Here again, pediatric cardiologist also comes in the picture.
True. So
These
nowadays there are so many interventional cardiology being done with fetus in utero.
In utero.
In utero.
Given the medicine to the baby
Yes.
inside the womb itself.
Yes.
Mother is hypertensive.
Yes.
She is on the toxic medicines.
Yes.
Baby develops hypothyroidism.
Yeah.
Here,
Yeah.
you can give in utero thyroxine,
Yes.
which is again very important
Yeah.
for the
Similarly
baby.
in twins also, madam. I think.
Yeah, laser we can
Laser,
do.
yeah.
We
Laser
can
reduction.
monitor them.
Yes.
We can do cord coagulation.
Yeah.
So multiple, this is a multi-team approach. That's what I say.
So for both the mother and the
baby.
child
Baby.
and the baby, so that would definitely help.
Anesthetists as well,
Yes.
ICU as well,
Yes, ma'am.
NICU specialists as well.
Yes, ma'am.
Yep.
So, madam, for a woman who is having a medical disorder, be it a pre-existing one or a new onset one, so what message would you leave them?
See, this is not at all good feeling. Nobody should have a medical disorder in the pregnancy. But yes, we can't, we keep on getting this kind of cases. Because of apprehension or tension, worry, they go to multiple places, like physician to one hospital, NICU to one hospital, delivery at one place, scan at one place. If we can avoid that, and she goes to one single center, which is well equipped with all the facility, where she has been taken care well, baby has been taken care well, and proper plan of the delivery and postnatal complications, post-birth complication of the baby we can avoid. That is the best we can give to the baby.
Yes.
That's what I suggest.
Yes.
One center for all medically complicated pregnancy,
Yes.
which has to be the best center.
Yes. Yes. So, monitoring the fetus is not to create an anxiety in the woman, but to reassure the mother that everything is going on well, and to create confidence in her when the mother is, especially when the mother is having a medical disorder. So here, the monitoring the fetus with the growth charts, as madam said, plotting the growth charts, monitoring the Doppler abnormalities, the biophysical profile, the Leica content, all these will help us in ensuring that the baby is doing well, even though the mother is having some medical disorder. And at Rainbow, we closely work as a team, not only the obstetrician, especially in high-risk pregnancies, the fetal medicine specialist, the neonatologist, the anesthesia team, and the super specialty doctors of both the pediatric level and the adult super specialty consultants, so that we ensure that the mother and baby have a safe journey and we have a healthy outcome and the optimum outcome for both the mother and the baby. Thank you.